All right. So for the Ottowa foot and ankle rules, you can have this doing the patient, or you can have the patient supine or seated. With the patient supine for now. Um, this is going to be testing for if you should refer the patient out for imaging for a fracture. So if more than 2 out of the 5 of these tests are positive, then you would suspect a fracture, and you would want to refer the patient out to get imaging before proceeding forward with any treatments or evaluations. These tests would need to be done within 48 hours of the injury. All right. So the first two are going to be pain over the posterior aspect of the distal 6 centimeters of the patient's fibula and lateral malleolus. So you would just palpate along the distal 6 centimeters of the patient's fibula and lateral malleolus to see if there was any pain. And you would do the same thing on the patient's medial malleolus and tibia. So on the patient's distal 6 centimeters of the tibia and on the medial malleolus, you would palpate just to see if there was any pain. And those would be the first two places that you would palpate. The next place you would palpate is over the navicular. The navicular can be found by getting on the medial malleolus and going about 1 to 2 centimeters, really 2 centimeters antero-inferiorly on the patient. So you're going to get on the medial malleolus and fall and work your way antero-inferior until you find a raised ridge, and that'll be the navicular tuberosity. You'll palpate the navicula and see if there's any provocation of pain there. The next one is at the base of the 5th metatarsal. So to find this, you could find the head of the 5th metatarsal and work your way down towards the base. And then once you're on the base, palpate the base to see if there was any pain, provocation of symptoms. And the last one is actually a gait test. So relax. For gait, you would want to assess it in 2 different areas, whether they could walk in the clinic or whether they could walk anytime immediately post their injury. So if at any point during after their injury they could take 4 steps, the test would be negative. And if they hadn't walked since their injury or didn't know if they could do 4 steps, then you would go ahead and stand them up, have the patient walk 4 steps, or attempt to walk 4 steps. If they could, then the test would be negative. If they could not, then the test would be positive. And again, if 2 out of these 5 tests are positive or more, then we would want to refer the patient out to imaging because we would suspect a fracture during the acute injury.